Welcome to Tackling CV Inventory Management Challenges with Automation and Operational Excellence, sponsored by an educational grant from Cardinal Health. I'm Mary Tierney, the Chief Content Officer of Cardiovascular Business Magazine and TriMed Media Group, and the moderator for today's webinar and live question and answer session. The heart of why we're here is to discuss how Cardinal Health Inventory Management Solutions helped Emory St. Joseph's Hospital in Atlanta gain greater and more effective control of their cardiovascular suite supply inventory. Today we're going to hear from Lisa Newton, BSN RN, who is the Unit Director of Invasive Cardiology at Emory St. Joseph's. She will detail how the facility, which is part of Emory Healthcare, the largest healthcare system in Georgia, overcame their supply chain challenges to manage more than $2.5 million in inventory in their 7 cardiac cath labs and 3 EP labs by maximizing revenue, optimizing clinical workflows, improving staff satisfaction, and supporting patient safety initiatives. Because inventory management can interface with other systems real-time, it cuts down on data entry redundancy and related errors, missing charges, and instead allows nurses to focus on patients rather than counting devices. It all comes down to better decision-making to balance patient care needs, utilization, and cost. We also will hear from Lisa Steps, Account Manager for Cardinal Health Inventory Management Solutions, who worked with Emory St. Joseph's throughout their inventory automation process journey. She will discuss how the health system was able to quickly capture ROI for their cardiovascular suite with minimal investment. At the end of the discussion, we will have a 15-minute question and answer session. If you would like to submit a question, please type it into the Ask a Question box on your console and hit Submit. We will get to as many as we can. Lisa Newton, let's get started with you. Why don't you tell me a little bit about Emory St. Joseph's? And then Lisa Steps, can you tell us a little bit about Cardinal Health?
Thanks, Mary. So as Mary said, St. Joseph's is a part of Emory Healthcare, which is the largest health system in Georgia. We're founded by the Sisters of Mercy in 1880. We have a strong focus on mission, and we are a Catholic hospital. We are leaders in the cardiac area, and I am currently the unit director for invasive cardiology, covering 7 cardiac cath labs and 3 EP labs. We are a magnet hospital. We have earned our 5th magnet designation, and we are ranked one of the top 25 hospitals in the nation. We were looking for a way a few years back to handle our inventory. We worked with Cardinal Health to implement a solution for us because we were looking at ways to reduce costs and also have our nurses focus more on taking care of the patient versus entering supplies and keeping up with inventory. So that's kind of how we started with Cardinal Health.
Great. Thank you, Lisa. And this is Lisa Steps. I'm with Cardinal Health. We are one of the largest healthcare supply chains in North America. Cardinal Health is essential to care. We help health system customers like Emory St. Joseph's focus on patient care while at the same time reducing cost, enhancing efficiency, and improving quality. Cardinal Health is known in the industry for a deep expertise in supply chain, and we have a strong culture of Lean Six Sigma practices. Cardinal Health has been recognized by Gartner as the #1 in supply chain innovation for 4 consecutive years, from 2011 through 2014. Cardinal Health helps the health system manage supplies from the supplier to the hospital to the patient bedside.
So Lisa Newton, why was inventory management a critical component to really improve the bottom line of your CV interventional procedure suite?
In the cath lab and the EP lab, we use some very expensive products, and we were finding ourselves running out of certain supplies, and of course that's not acceptable. So we looked at different inventory control systems, and it seemed that the Cardinal Health system, the RFID solution, seemed to work best for us. Now, one of the reasons for that, we have a lot of, as I said a minute ago, we have a lot of high-dollar items, and we wanted to be sure to control those items and keep them housed in various locations and know what we had on hand at all times. And again, with the changes that have come down for healthcare, we really wanted to control our costs. So one way that we decided to do that, we wanted to run a very lean inventory. And in order to do that, of course, you need a good inventory control system. We actually have one supply chain management gentleman who works for us, and he is able to cover both our cath lab and our EP lab using this system. And if he is ever out, I am able to order very easily through that system. But what we noticed a few years back, we decided that we wanted to start buying items in bulk so that we could really cut down on our cost in the long run. And again, like I said, some of these items are very, very costly, so we wanted to be sure that we controlled where these items were, and we knew that if something walked out the door or if it was used in a case. The other thing that was really important for us was I wanted a seamless process for my nurses to be able to grab an item and simply be able to wave it, and it auto-populate in our charting. That significantly cut down on our errors that we were having in documentation. As you may or may not know, any device that is implanted, we need to be sure that we track the serial numbers and know what patient we implanted what device in. Well, with the system, this is very easy because the serial number auto-populates into our charting. And so it makes a seamless process for the nurses. They don't have to go searching for a pick list, to find the item that we're actually using. Once they wave the product, it goes right into their charting. The other thing was we were having tremendous problems with our charges. So if the nurse were to pick the wrong item in the pick list, the patient would be charged inappropriately. With this system, we were able to know that we were getting the right product in our documentation and also in our charges. And it was a seamless process that went from the scan right into our documentation and then moved right into our charge method. So we really saw a decrease in the number of documentation errors, a decrease in the number of charge errors, and also it gave the nurses a lot more time to work with the patients and not have to worry about putting in, where am I finding this product, what product am I using? So it really pushed the nurse to work more with the patient and focus less on their documentation. We had a problem with running out of supplies, which we all know is not a good thing when you've got a physician needing a certain item. We were having issues keeping up with our high-dollar implantable devices, and as I mentioned before, really important for us to be able to track serial numbers and lot numbers on those devices. We also wanted to look at our cost and be able to track our cost by physician, by case, and by type of procedure. And then one big important thing, because I'm a huge proponent of nurses being at the bedside and taking care of patients and not having to focus on documentation heavily, I wanted a system that would allow us to streamline our documentation process and allow the nurse a little more flexibility to be at the bedside. Also, I wanted the documentation to be correct and cut down on our errors. When we have errors in documentation or in supply usage, you also are going to have problems with your charges and revenue. So we really wanted a system that would help us to identify missing items and that type of thing. And then we just really wanted to be able to, by physician and by case, be able to tell what we were spending per case and look at ways that we could streamline a process and perhaps reduce costs. And this system allowed us to do that.
So how did you go about choosing a solution and a partner for inventory optimization? And how did you go about getting buy-in from your management team?
So that was a pretty tough thing. We looked at many different systems, such as barcoding systems, and what we ended up deciding for our particular agency was that the best system for us was one that we could really, truly track our items in a real-time setting. So basically what I mean by that, we wanted to be able to, if an item went missing, I wanted to know it within 15 minutes, or within a certain time period, not to come in the next day and figure out, or the next time I did my inventory and notice, oh my goodness, this thing's been missing for a week and I don't know where this high dollar item may have gone. So we also had to approach our administrative team and look at the different options. And as we did this, we knew that the RFID system would be a little more expensive. However, with that said, we wanted a system that would track, again, as I said earlier, real-time inventory management. And we also wanted to be able to run advanced analytics to show what our usage patterns were down to each level of our product. We also wanted a system that would allow us to track all kinds of information about the product. And when we looked at all of these various systems, again, bottom line, it is a more expensive solution. However, with that said, the amount of data that you get back from this system is so very important. And when we were able to present that to our administrative team, it was definitely eye-opening for them to see that, hey, we can track all of this information. You have real-time data. And the other part of that is some of the devices that we carry in the EP lab are upwards of $20,000. So to be able to track that type of device is hugely important to us. There was also a collaborative effort. We had to not only get administration involved, but we also had to include IT because we needed this system to interface with all of our other programs. So it was various departments getting together to make sure that our workflow was what it needed to be. And so we came together with Cardinal Health, and we were able to look at what our process needed to be, what interfaces may have needed to be developed, and then how could we integrate that into our workflow actually in the lab. And again, you would think introducing something new to the clinical team that's more of a technological type thing may be more cumbersome, at times because we're used to pen and paper and writing everything down and keeping up that way. But this system actually was so seamless for us. It allowed us, again, you basically wave an RFID tag and everything populates into your documentation and then flows seamlessly into your charges. So it really was kind of a no-brainer for us in the clinical area. And then, like I said, we pulled our administrative team along with us to say, hey, this really does make sense, and it allows us to track a lot of data and in a relatively easy way.
So let's talk a little bit about the benefits. What benefits that you really have seen over the last 7 years?
Absolutely. So as I stated earlier, we have so many changes with healthcare coming down, and we're being forced to do more with less, essentially. So it's really important for us to look at what we have on hand. And so we're being pushed to run a really tight, lean inventory. And what I mean by that is I may have 2 items on the shelf, and I may use one of them today and need another one tomorrow. So it's very common for us to order daily. But that allows, again, for me to not have 5 or 6 sitting on the shelf where I'm ordering once a week. With that said, it kind of sounds like that may be a little more cumbersome to have to order daily. But with this program, basically you go in, you have par level set, you are able to place an order very, very easily, and it's something that you don't have to do every day, meaning I am familiar with the system, but I don't order every day. My inventory manager does. And so he goes in and he places the order every day, but if he's ever out a day, it's very simple for me to go in and order in his absence. That's how easy it is. Basically, it's sign in. The system lets you know what you need to order, and you basically hit a button and release it, and it goes. The other part of it, one of the biggest, again, I go back to nurses being able to have more time with their patients and cutting down on their need to document constantly. This system allows the supply to not be a hindrance to them. Basically, they wave an item and it goes right into their documentation instead of having them have to look through a pick list of 50 different items. And not only that, the help that it gave us in cutting down on charge errors, because, again, you've got a pick list of items that all look the same with just a variation in a model number being off one number. So with this system, it really cut down on our errors in charge capture. The system really allows us to look at different projections, so we can make projections about what are we using. And one big thing that we've done recently is really looked at buying items in bulk, because the amount of savings that is offered when you buy items in bulk is really significant. So with this program, what we can do is actually go in and run utilization reports and really be safe in saying, I'm projected to use this amount, or over the last 3 months, I've used this amount, and I'm pretty certain that my volume is going to continue as it has. And it really does allow you to safely buy items in bulk. Before the system, I remember buying a huge bulk and thinking, I have no idea how much I've used, because there wasn't an easy way to pull data from the system that we had. Basically, we had our documentation system. That was it. We had no inventory management control system. And so it was really kind of piecemealing data together. So with this system, it really allows you to get down to the granular level to say, this is what we've used, this is what we're projecting to use, and really make you feel confident in this bulk purchase you're about to make. The other thing that's really great about this system is it allows you to track expiration dates. And for anyone who's ever done any kind of inventory control management, you know and I know that Joint Commission comes in, they're going to find the one item that you've missed that was expired. They've got a nose for it. I don't know what that is. But this system gives us an expiration report. I get it you could set it up to be reported every couple of weeks. You could set it up to be reported every day. However you want it to run, you can set this up. But that's really important for us. We don't want to use, of course, item that's expired on a patient. And if you go to waive an expired product, you will be alerted at that point to say, do not use this product. So, again, there are safety measures in the system, and that one's huge for us. The other report that I really like is the missing item report. It allows us to know if an item has been pulled off of a shelf, and if that's the case and someone forgot to waive it, well, how long has it been off the shelf? So I can really go back and track where that product may have been used if the staff inadvertently forgets to scan it. So there have been so many benefits for us with this system, and it's helped us out tremendously and really allowed us to run very, very lean inventory levels for us.
So we've talked about physician preferences and things like that. Obviously, budgets are really tight all across healthcare, really everywhere. How do you think that automation has helped to deliver on your efforts with your value analysis program?
Sure. It seems like everyone right now is setting up these value analysis programs right now and projects just to kind of take a look at how can we streamline some of the products that we may be using. Of course, you're always going to have physician preference on certain items that they like to use, but really with this system, it allows you to look at what are you spending, what is each physician using, what is their cost per case, and why is it that this physician may cost $1,000 more to do this procedure versus a different physician who may be $1,000 less. So we really take this and look at, it allows you to do multiple things. When you get down to that granular level to be able to see what is your cost per case per physician, you can really go to the physicians and say, hey, did you know that this particular product is this much more expensive than this one, and they do the same thing. It also allows you not only to talk to physicians about that, but when your physicians and administration collaborate, it allows you to approach companies to say, hey, you guys, what do we need to do as far as pricing goes here? Because your item's $500 more, I'm just making up numbers, but $500 more than this other product, and how can we negotiate? So it really gives you the ability to have real numbers that you can go and say, we really need to talk about cost. And with the VAP team that I'm on right now, we actually had a conversation a couple of weeks ago about a particular closure device we were using. And as I said earlier, we're part of the Emory healthcare system, so we're part of 4 various hospitals, 2 very, very large other hospitals, and they were looking at their utilization and making a blanket statement across the board about, hey, we use this particular device across the whole system more than any other. Well, with Cardinal Health inventory system, I was able to go in and run a report and look at that St. Joseph's actually was about a 50-50 breakdown with the other 2 products. So it really allowed me to get down to a level of saying, hey, this is what St. Joseph's uses, and really talk about what our utilization was like and what our physicians preferred, and really have data to back that up. So it gives you cost information. It gives you physician information specific to each physician, and cost by case and procedure. So really we can look at how can we streamline and reduce our costs to the patients, and also provide the greatest care, the best care to our patients as well.
So Lisa Steps, let's jump into some questions for you. I'd love to have you talk about the big picture. I know we've been talking about the specifics at Emory, but the traditional methods of doing and managing inventory have been limited really to manual processes and using barcodes and things like that. What do you see as the driving factor behind Cardinal Health recommending RFID and the particular benefits there?
There are a lot of different processes that are in place. various cath labs across the country, anything from manual processes to documentation using their CVIS systems and usage, to drive kind of inventory decisions. Barcode solutions, which are completely line of sight, that don't give you kind of that real-time information. So the RFID solution is really that niche market where it really allows you to track your items down to the each level, down to the box. So at any given point in time, the user can see exactly what they have on their shelf. So you're preparing for cases for the next day. You know that you have exactly what you need. And if you don't, it also gives you alerts so that you can place an order so that you get those items in time. So the visibility that you have with RFID is really unprecedented. It is a good solution for those high-dollar physician preference items, things that you don't want to stock out of because of that visibility. The expiration tracking, as Lisa mentioned, obviously is a huge benefit with RFID because we're not just looking at an expiration for a particular lot. We're actually looking at the expiration date of each individual item that I have in my inventory and providing an easy user interface to manage those expirations. So being able to do proactive reports, say I'm going to send a report out that will show the expirations for 90 days out or 180 days out. And maybe these are slow-moving items, things that haven't been used. And it actually gives the user then a chance to make a decision on those. Can they swap them to another department within their hospital that has a more frequent use of those products? Or can they work with their vendor, to swap those items out? So that real-time visibility, that each level tracking, really important for the end user. And I think that's where we've been able to align with the goals of St. Joseph's Hospital in particular in their cath and EP lab to meet those individual goals and help them, along their inventory management transformation path.
So obviously patient care is number one in healthcare. Can you talk a little bit about the patient care benefits that you're seeing?
Yes, absolutely, because that is the most important thing, right? We're managing supplies and all of that, and we have a lot of great tools to do that, but ultimately it's to provide a better patient experience. We want the system to provide the data to support the decisions that are being made, but we also want to support the workflow in the lab, and that's a really key component because when we come alongside and we partner with our customers, we really look at what that workflow looks like. What are they doing today? As Lisa pointed out, the clinicians having more time at the bedside was really important for them, and they have an exemplary track record in their patient care, high patient satisfaction scores and things like that we really wanted to help them not only maintain but exceed. And so being able to look at their workflow and implement a workflow that didn't increase their time, increase the clinical time and inventory management, but allowed them to document products more effectively, align with their current systems that were already in place. We didn't come in and look at pulling things out, but we looked at really kind of building an end-to-end solution. So when they bring a product in from the dock all the way through using it at the patient bedside to billing, it's one seamless workflow. Benefits to the patient, one, the proactive expiration management, very important. I don't want to risk that I have an expired product on the shelf. That's very important to our end users. So being able to proactively remove those items is key, but there's also that fail-safe, that last line of defense, if you will, at the point of use where they waive an item, and if it's expired, it gives them a big red alert that says this product is expired. So they know that before they implant it. Also, recalled items. We have recalls that are built into the system, so they get proactive recall management alerts. So if they have products that are in their inventory, it will alert them that they have these recall products in inventory and tells them exactly what shelf and cabinet that it's located in so they can remove those. But it also, the last line of defense again, at the point of use for the patient, if you waive a product that has been recalled, you get that immediate alert that this is a recalled item and that, then they know not to use it and to handle that, through the appropriate, internal process. But again, you don't get those kinds of benefits from barcode tracking. You get those benefits from RFID and looking at that each level tracking down to the lot and serial of a particular item. So those are really important for our end users, really important for us, Cardinal Health, to be able to come alongside and help meet the goals that the customer has established. So some of the benefits on the back end, while we're streamlining the ordering process processes, streamlining the clinical workflow, streamlining the charge processes, and improving the documentation. Some of the data benefits behind that are very important. So we're able to automate 100% of the expiration tracking processes for the end user. So prior to having a system that is RFID enabled, like the Cardinal Health Inventory Management Solution, there's a lot of manual work, looking at the expiration date on boxes, maybe marking it with dots and highlighters and things like that, and we eliminate that. We allow the system to track those expirations. So 100% expiration tracking, and it's proactive expiration management. Same with recall alerts, automated 100%. So it's those types of savings and those types of benefits that allows the end user to have more time with their patients and more time with other processes. For example, also there's labor savings. If you look at some of our customers have really been able to reduce the amount of time that's spent in just trying to figure out what to order on a daily basis. So the Smart Order feature allows them to order within minutes to restock their entire lab, place the orders for those products that are so critical to patient care. So on average, they can save up to 3 hours a day just in that ordering process alone from a labor perspective. So some of those soft cost savings, but they really impact the end user. Also eliminating shipping costs and things like that, because I'm not now being reactive to those demands. I'm all of a sudden I realize I'm out of something and I've got to get it in right away. With this system, you're alerted in advance to those kinds of things. So the data piece, very, very critical. At St. Joseph's and partnering with them, looking through their data, working through some of the reporting processes, we were able to identify that they had a 60% increase in their inventory turns for the EP lab alone. So it's very data-driven. So the initial process just happens by, the natural workflow of the lab. I'm using products, I'm taking care of patients. The data that you get on the back end allows you to do so much more. It allows you to change the conversation with your physicians, because you can look now at real-time usage patterns with each physician. So no longer are you making an assumption about products that are used frequently or used all the time. You have the hard data by physician to start those conversations. And I think we find with our customers that are very engaged with their physicians and value analysis programs is that now the physicians are coming to them, right, and asking for this information and looking at how they can utilize this data, cost per case, and all of those things. So very important. The analytics piece is very strong, and that is a result of the RFID tracked items at the individual level.
We talked about patients. I think we need to dive also into ROI a little bit. I'd really like to get your perspective, Lisa Steps and Lisa Newton. So let's talk about ROI at a glance.
Great. Thank you, Mary. And I think that is one of the key benefits of the systems is looking at that return on investment. So as a partner with St. Joseph's Hospital, we were able to work together on kind of identifying some of those opportunities for ROI. And so, Lisa, talk a little bit about what some of those goals were and how you're able to achieve those using the data from the Cardinal Health Inventory Management Solution.
Sure. So we looked at, I can't talk enough about the expired product report, because we're able to look at our supplies that we have on hand and what's upcoming expiration, and it allows us to do things like go back to the vendor and say, hey, do you have another hospital in the area that's using this product? Can we swap it? So it really allowed us to cut down on items that we had expiring, which is pure loss of money right there when you have an item just expire because you've bought it and there's no return on that. And I think that one of the other things that I would say that has been huge for us, we actually were able, it may not sound like a huge deal, but when you have nurses putting in charges and really taking a lot of time in their documentation, you really got to think about how much time does that take whenever they're sitting down at a computer and actually having to enter charges. With this system, again, it was a seamless process. The documentation populated automatically, and it went right into our charge capture. So you're freeing up nurses, again, to be able to actually take care of the patient, which in turn allows your case time to decrease, which in turn allows you to do more cases. So again, the charge entry and capture is a huge thing allowing us to increase our number of cases and nurse time with the patient. the system has taken us from a reactive kind of phase to being more proactive. So we actually could see very quickly that we were not running out of items. We weren't having so many expired products. We were having better documentation, thus cutting down on errors in our charting and also allowing our charge capture to be more accurate as well. So those are just a few items that for St. Joseph's were huge returns on investment.
So a lot of ROI factors really, important, and some of the things that they were able to take advantage of, and Lisa, you can talk to some of this too, is the soft cost savings in labor, and and how those savings just because of the automation piece and the reporting capabilities.
Absolutely. So it's very important that if we have expired items or something that is being recalled, that we are alerted to that. And with this system, it's actually ease of that is tremendous. I can't say enough about it, but it allowed me to free up my nurses. Again, I don't have to have someone going and looking for these items. I know exactly what items are expiring. I don't have to have someone out there going through items 3 times a week trying to figure out what items are about to expire. So it truly changed it from a manual process to an automated process. Also, the other part of it, and I mentioned this a little earlier, was just the time spent in ordering. I don't have to have someone go out and physically count what needs to be ordered. I have an automated process that tells me exactly what I need to order based on my usage. And so that really did cut down on time as well. So one other thing is, again, I don't have to be as familiar with the system. I could sign in and it tells me exactly what I need to order, and it's a seamless process. So I don't even have to physically be at St. Joseph's to manage this inventory control system. I can actually be on vacation and log in and know exactly what we've used and place an order from there. So I think that those are huge benefits. And again, it really did cut down on labor for my staff and allowed them to do what they love to do, which is take care of patients instead of managing inventory.
All right, so let's do a little bit of a wrap-up. Lisa Newton, you talked about a lot of advice today and some really concrete benefits. So what other advice do you have to pass on to other CV managers and directors about tackling inventory management issues?
Be patient, number one. It's a huge undertaking when you first begin to start the process and talk about inventory control. We all know that that can be one of the most frustrating things in the department, trying to make sure that you have all the supplies you need and you've got tons of different items and your physicians, and it varies from physician to physician. So number one, be patient in building your system. Look at your options and really see what's going to work for you. For St. Joseph's, that was an RFID system, and we really wanted to have real-time control over our inventory. And it truly has helped us to cut down on what we carry and run a very lean inventory, which is becoming, again, so important with this new state of healthcare that we're in right now. But again, what I'd say is don't be surprised at the cost of it, too, because what you will get on return is going to be much more than what you will invest in it. So I think that you need to realize that what these systems will give you is so important from an analytics perspective, from a automation of ordering, from expired products to freeing your staff up more. When you think about it, if you can do 5 more cases a month, that right there, the system probably pays for itself. So this system really does help you do that. But again, if you're looking for a partner who will work with you, my experience with Cardinal Health has been really, really a positive one. We partnered well together. We were able to build interfaces with all of our systems that we had. And again, it is truly a seamless process, and working together with them has been really good for St. Joseph's and our inventory control. So in closing, what I would like to say to any cath lab or manager or director is, be open to your solutions. As we know, healthcare is changing and controlling costs are becoming more and more of a issue at the forefront for us. So look at the system that you're evaluating and figure out ways to allow your staff to get back into the clinical areas a little bit more and decrease their time managing supplies. really look at it from a financial impact. How can it help you to, what analytics are offered from the system, and how can that help you in the long run with ordering and controlling your costs there? And then last, what other benefits can it add for you, such as controlling the expiration of product and really allowing you to go back and be able to exchange products, that kind of thing, before they expire. So you're actually saving money in the long run in a roundabout way. So I can't talk enough about the clinical impacts, and the financial impacts that this system affords us right now.
Thanks so much for joining us for the live question and answer portion of the webinar. I'm Mary Tierney, the Chief Content Officer of Cardiovascular Business and TriMed Media Group, and I will be the moderator today. If you would like to ask a question, just please type it into the Ask a Question box on your console and hit Submit. We'll get to as many questions as we can in about the next 10 to 15 minutes. And on the live with us today, I'm very happy to have both Lisa Newton from Emory St. Joseph's and Lisa Steps from Cardinal Health, who are both ready to answer your questions. So we do have some questions that have already come in. So let's get started. Lisa Steps, I'd like to start with you. How is this RFID system different or better than a barcoding system?
So thank you, Mary. And for barcoding, it requires kind of a different methodology, right? So you're looking at a direct line of sight between the barcode scanner and the barcode itself. So proximity of the product to the barcode scanner is important. That's different with RFID because you don't have to have a direct line of sight. It's RFID tagged, so you have a different tracking mechanism. So you're really tracking down to the each level tracking. And with the automated cabinets, it's able to track your inventory in real time. So you always know what you have on the shelf at any given point in time, down to the each particular box and size of product. That also allows us to have greater visibility over the expiration dates and accuracy of all of the items that are in your hospital inventory or your department inventory. So typically we look at barcode items or things that are high throughput but maybe lower dollar, where RFID tracked items are each level tracking. So a little bit more of your physician preference items, your more expensive items. So we think RFID tagging for those items is a better choice because it gives you flexibility and visibility for those items and that have a greater impact on patient safety and so forth.
That makes sense. Lisa, maybe the next one you could take. So obviously from the facility side of things, where does the tagging of the RFID product take place, and is it time-consuming?
Sure. So in our facility, we actually have a tagging station in our supply room where our inventory manager tags the items. It's a really quick process. In fact, we've even trained our clinical staff how to tag items. And what we do is during our downtime, we actually have clinical staff who will tag as well. Tagging the items is less than, you could probably tag an item in less than 15 seconds. You can tag and register an item. So it's a really seamless process. And like I said, we've been able to train our clinical staff to do it as well, not just our inventory manager.
Great. And another question, Lisa Steps, I hope you can take this one. How does the system determine optimal inventory levels?
Great, yes, glad to take this one. And this is actually one of the prime features of the solution. We have a smart PAR tool that actually looks at the utilization of your actual usage in that department. So by item, it looks at the max number of products that you in a period of time, maybe a week, your average daily usage, your max usage for that time period. The algorithms also take into account lead time for those products. So you have the right amount of product on the shelf at the right time. So the PARs are driven based on utilization and tools that allow you to see that and have that visibility into that. For RFID products and also for our two-bin Kanban supply items, so commodity items, we look at bin rotation and we're able to optimize bin PARs as well. So it is scalable and it gives you flexibility to look at your PARs across the continuum of products that you have on hand.
Okay. And then maybe you could continue with another question that says regarding cost. How much does the solution cost and how is it priced out?
So that's a good question, and it is varied because the system is very scalable. So it depends on the number of departments, depends on the size of the department. Say, are you 2 labs or 4 labs in maybe a cath lab? Maybe you're bringing in an OR. So various components. So we really price the solution based on the specific customer's need. We look at, those key aspects, the types of supplies that are being tracked, and are they RFID tracked or tube-in tracked, and we try to apply the right amount of technology to the right type of supply. So we also, consider in there that the ROI is very important, and our customers usually realize ROI within a year, so the system really pays for itself. It not only allows you to right-size your inventory, but it also allows you to sustain that over time. So it's very scalable in that way. We just work with our customers through an assessment process where we really look at, your space and your amount of product that you have on hand and really assess all of those key components to allow us to recommend a solution that's right for that facility.
Great. Okay. Lisa Newton, I'd like to jump back to you and specifically, speaking a little bit about, somewhat of the cost thing, but how quickly did you see a return on investment?
So that's a question that a lot of people ask. So I'm a nurse, as you guys may have noticed, and so one of the most important things for me is making sure that our documentation is correct, and of course taking care of our patients. But what we noticed right away was when we implemented the system, our documentation improved. The nurses were allowed to spend more time with the patients instead of actually having to worry about picking an item from a pick list. So our documentation improved, which in turn improved our charge capture. So no longer were we missing items or charging for the wrong items. And then also the system allows us it imports the serial numbers and lot numbers of the items. So we were able to capture that data. Again, one more thing that the nurse didn't have to worry about documenting. We also were able to decrease the amount of inventory we had on hand. We had a system that we trusted for inventory, and we were able to decrease the amount of product we had on hand. So that, of course, cut our expenses as well. And then we were able to track products that were nearing expiration. So we were expiring quite a bit of products prior to implementing this system. The system allowed us to actually work with vendors to swap out products that were nearing expiration. So we saved a lot of money in that respect. Later, after we've had the system for a while, we were able to look at how we could purchase items in bulk. And looking at the system, we would go back and look at what we had used per quarter, every 6 months, and it would allow us to make a smart decision on bulk purchases. So the return on investment was really, really quick, and then we've seen some return on investment later as we've kept the system as well.
Great. Okay. And then another question kind of related to this, obviously, is how long did it take to train your staff to utilize the product?
So I'm going to answer that in twofold. So the training of the clinical staff was very, very easy. The system's really intuitive and user-friendly. It was literally teaching our staff how to select the employees that are in the room, the doctor who's performing the case, and that's all done on a computer. And then learning how to wave an RFID tag, which is really simple. You're basically placing the tag up in front of a reader, and so it was a really simple process for the staff, so really quick. The initial implementation and training for our inventory manager took a little longer, of course, but we partnered really well with Cardinal Health, and they were with us every step of the way. We had folks on the ground in the hospital helping us with that implementation process. And again, even for, as I mentioned earlier, we have since trained our staff on how to tag the product as well. So, and that was done really, really quickly. And again, that was due to a great partnership with Cardinal Health, and Lisa Steps would come in and actually teach our staff how to do that. In fact, I've taught staff how to do it. So it's a really seamless process and very user-friendly.
Terrific. So I do have one last question, that kind of two-parter that I would appreciate very much if Lisa Newton could take first, and then Lisa Stepp, you as well, because I think this is a really good question. Lisa Newton, does this technology link with current systems such as an EMR or hospital information system?
It actually does. We use CardioLab and MacLab in the Cath Lab and EP labs, and WaveMark basically will interface with that system, and we actually, the Cardinal Health product will actually interface with that system, and we are able to have the product go from the RFID reader into our documentation. Again, if it's an item that we want to track the serial number on, it populates automatically once the item is waived. And then it goes from that system over to our IDX system, which actually is our charge master, and we're able to capture charges in that way. So again, it's a seamless process for the staff. It makes a world of difference to give them more time with the patient and less time having to worry about picking the correct item in a pick list, especially when you've got as many items as we do to choose from. So it interfaces really well with all of our current systems.
Okay. And then Lisa Stepps, maybe you can, from a broader brushstroke from the experience that you have with other facilities and things like that, how does this technology link in general, with EMRs and hospital information systems?
Yeah, no, glad to. I know Emory St. Joseph's has done a great job integrating their systems and gaining the benefits, but we see that with a lot of our customers, so we're able to interface with multiple systems. So, for example, we interface with several materials management systems, so we automate the ordering process. So we create orders in our Cardinal Health solution, and those go through interface into the material system, and then POs are returned back into our system. So we can actually track products against the PO, which is very helpful. We really look at how we integrate the entire spectrum. So everything from ordering down to the usage capture in the room. And as Lisa said, we integrate with clinical documentation systems in cath, EP, OR, various scenarios with various vendors, so that we do a one-time data capture. So we don't have to document into systems, so we streamline the documentation process. We improve the charge capture process because we can either send products into the clinical system and then feed billing, or we can do a direct billing interface for those supplies. So there's flexibility depending on the needs of the customer. But I do think that's one of our greatest strengths is how we integrate so that we have that full end-to-end visibility from the time a product comes into the hospital till the time it's used to the time it's billed. It just creates a nice audit process for that integration piece.
Great. Okay. Well, I think we're going to stop there to be mindful of everyone's time. I do want to say thank you so much for joining us today, and a special thank you to Lisa Newton and Lisa Stepps for your great answers. And thank you, everyone, for the answers to the questions that you did submit. This has really been a great session. I know I've learned a lot. If we didn't get to your question today, I want to make a mention that someone from Cardinal Health will definitely be reaching out to you with an answer. And if you missed any part of this webinar or would like to listen to it again, or even forward it along to a colleague, you will be emailed a link over the next couple of days to the on-demand event that can be shared. Thanks, and have a great day.